very much, Alicia, for this introduction, and welcome everybody to this webinar. My name is Ariane Hegewisch, and I am going to introduce and moderate today's webinar on domestic violence as an issue for apprenticeship and pre-apprenticeship programs. And I would just briefly like to introduce the other speakers and tell you what we're going to talk about before I'll jump into my bit. Before I start, just to mention that we are recording the webinar and we are going to distribute a link to everybody who registered in a week or so after the program. And also to say you can type in your questions at any point in time during the webinar, but we are planning to leave time for questions and comments right at the end after all four of us have spoken. So about today's speakers, as I said, I'm going to briefly introduce the reasons for focusing on domestic violence for career and technical training programs and apprenticeships particularly. And then I'll hand over to Sarah Gonzalez-Buzinski. Sarah is the program director at Futures Without Violence, who are kindly co-sponsoring this webinar. And she also is the author of the briefing paper, which really is the background or the incentive for doing this webinar, and which was distributed to everybody who registered. And Sarah works as the program manager for the Economic Justice and Workforce Initiatives program at Futures, and she's going to talk about the policy responses to domestic violence. And she will then hand over to Tiffany Thompson from Oregon Tradeswomen. Tiffany, Oregon Tradeswomen, just as the Institute for Women's Policy Research, are members of the National Center for Women's Equity in Apprenticeship and Employment, which is hosted by Chicago Women in the Trade. And we are supported by a contract from the Department of Labor's Office for Apprenticeship to specifically work on technical assistance and initiatives to improve diversity in apprenticeships. And Tiffany is going to talk about Oregon Tradeswomen's work with apprenticeship programs and contractors on addressing issues such as domestic violence and other issues that can improve or not improve the working environment for women in apprenticeships. And then finally, Tiffany will hand over to Erica Yingling, who is working at the YWCA in Greater Cincinnati, and is going to talk about a great pilot program which they developed in Cincinnati to network all the different groups and agencies who are working with survivors of domestic violence, from programs to directly support them to training providers and I think also community colleges. All right, so now let me say a little bit more about the National Center for Women's Equity in Apprenticeship. Here you can see the map. Really, we are a network of about 5 or 6 programs, organizations who directly work with women in apprenticeship to improve diversity, as well as 2 research partners, YWCA, my organization, and the Transportation Learning Center. And we work in the network are also 4 employer groups or industry opportunity partners, which is apprenticeship programs, really the national apprenticeship programs for the sheet metal workers, the iron workers, the masons, and the finishing trades. But as a group, we work with any apprenticeship program who is interested in working with us. So I know that we have quite a mixed group of attendees, which is very exciting, both from the apprenticeship and pre-apprenticeship side and from groups and organizations who directly work with survivors of domestic violence. And while I work on apprenticeship and assume everybody knows exactly what it is, not everybody might, so let me say a little bit about apprenticeships. Apprenticeship is an earn and learn model, which means that you are employed, you are paid, you have somebody who mentors you and you learn on the job, and at the same time you also have off-the-job training. So it means you are paid while you become qualified and gain industry recognized qualifications. In the United States, apprenticeships are most common in the construction trades, although they're growing in some other areas. And typically the registered apprenticeship programs who we work with in the trades are also the apprenticeship programs that have the highest wages and lead to the highest paid occupations once the apprenticeship is finished or the person is journeyed out. The typical starting salary as an apprentice, depending on which field or so, is around $14 per hour, if not more, with benefits. And then there are regular pay increases throughout the apprenticeship to acknowledge greater competence after learning on the job. And an apprenticeship in the trades lasts from anything minimum of 2 years to 5 or 6 years. But unlike college, it takes as long as college, you earn while you become qualified. Now, alas, unfortunately, women are severely underrepresented in these high-paid quality apprenticeships, and the National Center for Women's Equity in Apprenticeship and Employment at Chicago Women in the Trades was set up to try and improve diversity in apprenticeship by providing technical assistance, and also our members typically also run their own pre-apprenticeship programs. Slide for myself, right. So as part of that, you can see here we provide technical advice and resources. And here's a picture of the briefing paper that you have, which Sarah wrote, as well as another paper on harassment that's up there. So there are lots of resources on the site of the National Center, but we'll also link to resources from Futures. So we're going to discuss lots of issues, but there are also hints of what to do afterwards. Right, now to start on the issue of domestic and intimate partner violence for apprenticeship and pre-apprenticeship programs. Unfortunately, domestic and intimate partner violence is a painfully common experience. Over a quarter of women and over 1 in 10 men in the United States report to have experienced sexual violence or physical violence or stalking by an intimate partner in their lifetime. So very common. We at IWPR started to work on this when we conducted a survey of support service and training programs, and one of the pre-apprenticeship programs we worked with just said that typically there always is at least one participant who they know is experiencing domestic violence. 1 in 22 out of 20 to 25, and that program, you know, to safeguard people, really run the program as if they were middle or elementary school. They basically are on lockdown during the day, and nobody can come in who can't pass security clearance. So in, as you know, the surveys, a number of surveys coming up with a range of results, but you can see here, you know, it is common also in training programs that people who are in training programs experience violence. You can imagine, you know, domestic violence is about control and about exerting power over the partner, stopping them from earning a living, stopping them from bettering themselves, stopping from access to transportation, kind of trying to torpedo childcare, really keeping the person dependent and stopping them from being successful. Apart from being dangerous for the survivor, the target of violence, domestic violence can also be threatening to staff and other students in programs, and a lot of violence in the workplace is related in one way or another to domestic violence. And of course, unfortunately, there are also situations where the abusive partner, he or she herself, are co-workers or co-students, fellow students in a program. Just to look at this from another way, we conducted, there was meant to be some more information on this. So we conducted a survey among training programs, and 9% of those, so almost 1 in 10, said that domestic violence is among the top 3 reasons for women for not to complete training programs, for dropping out of programs. Here are some sites from a survey which we recently conducted among survivors of domestic and intimate partner violence, which kind of highlights this, you know, the control issue and making it really hard for people to succeed. You know, such as torpedoing childcare, calling the employer to say that, you know, they have to come home or there's an emergency, or turning up at work or in school and threatening co-workers or the worker herself. And of course, these issues such as torpedoing childcare or transportation, or saying you have to come home because there's an emergency, unless you know that this is going on, it looks like maybe this person isn't as committed, maybe she's sick all the time, maybe she left because childcare doesn't work, right? But it may be actually an abusive relationship which causes all these effects. So just to summarize, the domestic violence and intimate partner violence is very painful and very costly for the individual, but it's also costly for employers and contractors on programs. You can see here over 4 in 10 workers almost have, or 4 in 10 workers have experienced or witnessed the impact of domestic violence in the workplace. That reduces productivity. There is a big loss in terms of absences in response to domestic violence. And even though our estimates of how much the macroeconomic costs, the business costs are for this, is a little dated now, it was almost $750 million in 1995, so a big impact on businesses. And last not least, it's a big factor in incidents of violence. So what prevention is better than being called out and recognizing the problems and trying to help the people involved in it, and knowing where to turn is really the next part of what the others are going to talk about. So I would like to pass now to Sarah to talk about policies and the law.
Good afternoon and good morning, everyone. Thank you, Ariane, for having me, and I'm glad to be joining my fellow panelists today. As Ariane mentioned, pre-apprenticeship and apprenticeship programs provide really meaningful pathways to economic security. They have great wages, great opportunities to get benefits, and career ladders. So they're really important for us to consider as an option for survivors as they are to rebuild and build their own economic independence from abusive partners. Because we know that financial independence, that access to health care, provides survivors with options and opportunity, the resources they need to leave and recover from violence. However, unfortunately, perpetrators know this as well, and they often seek to disrupt these opportunities to survivors, building their own economic security. As Ariane says and showed the research, we know this is true. I'm sure many of the domestic violence programs who are on the call here have heard similar stories from the clients that they're working with. It's a really significant problem. So I'm here today to really talk about how programs can proactively address this issue and make efforts that are going to really help student participants be successful. So when it comes to addressing violence and its impact in the workplace, employment opportunities, job training, other educational programs, the responsibility is often placed on the shoulder of survivors, essentially ignoring the problem, hoping it's going to go away, or just not recognizing that this has a serious impact on the participants in your program that you're hoping to advance into these careers. And of course, there's a strong moral argument to creating environments in which all trainees and students have an equal opportunity to thrive. This isn't always enough to motivate positive behavior. The Occupational Health and Safety Act, for example, can be interpreted to address intimate partner and sexual violence, as these acts are known to cause serious physical harm and often death. However, few have actually used the OSHA Act to really think about it in an anti-violence, creating safety in the workplace kind of measure. The ADA and FMLA, while don't explicitly cover survivors of intimate partner or sexual violence, many of the health consequences that survivors experience, such as physical injury, depression, or PTSD, are often covered under those acts and provide some protection for survivors. And while there are a few states and jurisdictions that have anti-discrimination laws that cover individuals experiencing gender-based violence, there really isn't a lot right now that provides for protections and really works to enforce equitable workplaces and educational opportunities for individuals. Of course, every state and jurisdiction is a little bit different. I encourage you to look up your own local laws, but right now the framework's really kind of patchy. So let's assume that there's a good organization out there who really wants to address domestic violence, understands that it's impacting their workers or students, and that it's impacting their success overall. So how do they start? Outlining a solid policy is really key to addressing violence. Without that foundation in which to operate, you can't really have meaningful intervention. And please note when I'm talking about policy here, I'm really specifically talking about domestic violence and sexual assault policies, which are different than sexual harassment policies. Many programs already have that. Those policies focus specifically on legal liability. But a good domestic violence policy really goes beyond that. It offers a comprehensive response to gender-based violence. And in the few minutes I have, I just wanted to outline some of those key elements. First, it must demonstrate that the workplace stands against abuse and violence and stands with survivors and victims. It broadly defines domestic violence, sexual assault, and stalking to be inclusive of all identities and relationships in which abuse can occur. It ensures confidentiality and privacy. If survivors don't believe that their report or their call for help will be kept confidential, they will not report. It is a matter of trust, and it is a matter of safety. Now, there are some policies, some of you may have them, that choose to name individuals as mandatory reporters. The definition of what a mandatory reporter is varies widely, but essentially what mandatory reporters are individuals who must report to a certain leadership position or trigger an investigation, and makes it impossible to uphold survivor privacy and confidentiality when they're contacted. So there are some good reasons why organizations choose to do this. There's the liability aspects that they're concerned about. There's workplace safety aspects. But effectively what this does is undermine survivor autonomy and results in survivors not coming forward in the workplace, which essentially doesn't lead for safer workplaces in the long run. Thinking about confidentiality and privacy is really important in how to balance those often conflicting needs. So let's assume someone does want help. They are experiencing violence. They want to let the organization know, the program know, and see what kind of support they can get. What is the process for doing this? To whom do they report? What information must they share, and what can remain private? A good policy should really clearly outline what the path to seeking help is for survivors. So now we've had someone who's shared their experiences, and what happens next? What process can they expect? Is there going to be an investigation? If so, what does that look like? What processes will the organization put in place to ensure the individual's safety? What accommodations can be made to promote that individual's ability to continue in the program without jeopardizing his or her safety? For example, actions such as not sharing information about the student's identity without their consent, moving them to a different work site, changing their phone number. Simple actions like that can help an individual safely remain in the program. And finally, recognizing that perpetrators may also be enrolled in a program or on staff, how do agencies respond if someone has reported that violence has been perpetrated by an individual on site? What's the procedure for investigating allegations? What steps are taken to protect students and other staff? Clearly answering these questions can eliminate confusion and really create a strong foundation for an institutional response. And now I know this is a very quick outline of just some of those key elements. I really encourage you to look for more specifics and language on our own website at Futures, at our Workplaces Response Resource Center, and that's at www.workplaces-respond.org/resource-library/model policy. And you can see that on the screen as well. We do a lot of other technical assistance to help individuals review and create effective policies in their own programs and workspaces. But that's not quite enough. So we have our policy, but we want to make sure that this policy is actually victim-centered, survivor-centered, and that it promotes the well-being of those individuals we're trying to protect and trying to empower. So I have a question for everyone to turn to the chat box. We've just reviewed those key elements of a domestic violence policy, but what does it mean to be victim or survivor-centered? What kind of things do we need to think about in crafting a policy? See some responses, and I'll read them out as they come in. Considering the needs of survivors, desires of the victim, confidentiality, what does safety look like for the individual survivor, safety, believe them, being trauma-informed, great, letting survivors know their choices, that there are policies and practices that are available and they're informed about them. They have choices and make the decisions based on their own situation. Mentorship, providing resources, Victim Bill of Rights. These are all great. Yes, essentially you're all having policies in place. Thank you very much. That's so critical, so very critical. We want to make sure that ultimately these policies are prioritizing victims' wishes, their safety, and their well-being. Again, like I said earlier, this is not a liability model here. This is really making sure that these individuals are able to thrive equally and in the workplace, furthering equity for all. Thank you for sharing your responses in the box. So I'm going to take another couple minutes to quickly go over some of the points, many of them you mentioned. First and foremost, survivor agency and autonomy is key. Survivors have had their voices and choice denied by abusive partners, so when possible, allowing survivors to inform the process is essential. Survivors are in the best position to tell you what they need to be safe, so ask. What do they need? Share what you can do, what accommodations are available, and again, ask how we can support you. Ensure confidentiality and privacy. Don't share information provided unless the individual gives permission. Be clear about the process and follow through. This helps to build trust and helps other people realize that you're taking this very seriously and you're trying to make a good faith effort in supporting survivors. And share contact information with local service providers who are trained to help. We don't expect job training programs, apprenticeship programs to take on a new hat and become advocates for domestic violence survivors. We want them to understand what the tools are and how they can access them and best support individuals who are experiencing violence. And when the perpetrator is another student or staff member, it's important to hold them accountable. For example, don't punish the survivor by changing their work site. Make sure you're moving the perpetrator and not inconveniencing the individual who has come forward. But having a strong victim survivor-centered policy that's trauma-informed is not enough. Administrators, staff, students, anyone who's in the program must be made aware of what gender-based violence looks like and what the workplace policy is, or school policy is, program policy is in response. It's not simply something that you can do by handing everyone a flyer with this information. It must be discussed in meaningful conversation and trainings. It has to be an ongoing conversation, just not a one-time checkbox. Using awareness months as opportunities to talk about the issue can be helpful. It has to be an ongoing dialogue. Also making sure that you're training anyone and everyone who may be disclosed to, making sure they understand their role, the policy, and importantly, how they can provide support in trauma-informed way. You don't want to have a situation where someone is seeking help and is harmed unintentionally often by a teacher, supervisor, or other student who engages in victim blaming, violates confidentiality, or just doesn't know what to do to help. So by giving those individuals the tools to effectively respond, not only builds their confidence, but also helps survivors get the support they need. Finally, conducting safety audits can help programs identify gaps in security and identify better ways they can support safety for everyone. And we have example guidance on the bottom of the screen there at workplaces response/resource-library/incident-prevention-response. And just a quick note, I know I'm quickly running out of time here, in terms of what key issues we're looking for in response when someone does disclose. As was mentioned in the chat box, start by believing. That's the first thing. It's the easiest thing to do. Don't question what happened. Express concern and listen. And when appropriate, educate them about the individual about their rights and applicable what your workplace policies are. Share community resources such as information about a local domestic violence program or employee assistance program. Tell them what their options are in the context of what you can do to help and what the process looks like, and provide support. For example, those meaningful accommodations I mentioned earlier, what the organization can do to support their ability to remain safe and remain in the program. And of course, this is just a start. There are many considerations, and being well trained is critical to ensure that the response to a survivor victim is trauma informed and that the interventions are helpful and not harmful. So I strongly, recommend when you are considering to work on policies and protocols that you do it with a local service provider who has expertise in serving domestic violence survivors or survivors of sexual assault. For a listing, you can go to www.justice.gov/ovw/local-resources. They will have a lot of great programs, some of whom are on the phone, who can help support you. I encourage you to take advantage of their knowledge. And finally, the Workplaces Response is a National Technical Assistance Program, and I encourage you to look through our website. We have a wealth of resources and materials, and we are available to do technical assistance to help you craft policies and procedures to strengthen your programs for individuals who may be experiencing violence. So thank you all for your time and attention, and I'm going to turn it over to Tiffany.
Thank you so much, Sarah. I appreciate it, and I am glad to be on this webinar with all of my co-presenters and with the folks who are attending. Thank you for being here. So first I wanted to start a little bit, give some background on what Oregon Tradeswomen is. We are a nonprofit organization located in Portland, Oregon, and we are dedicated to promoting success for women in the trades through education, leadership, and mentorship. And so one of the primary things that we are known for is what we call our Pathways program, and that is an 8-week pre-apprenticeship program. So often for women wanting to get into the trades, they do not have family members or other connections that can help them get into the industry and may not have had an opportunity to actually practice those skills and get the work experience that they would need to be competitive for getting into an apprenticeship program. So our pre-apprenticeship program is 8 weeks long, and it is provided at no cost to the participants to help them get into this industry. So for those of you who are working with survivors of domestic violence or who are in the process of leaving a relationship like that, I would definitely encourage you to consider the trades and also pre-apprenticeship programs as an option for that economic stability, which I know Sarah mentioned, but I'm going to just keep saying it so that that gets hammered home. The other thing is that at Oregon Tradeswomen, we are lucky enough to have 3 staff who are former domestic violence advocates. So we have a wealth of experience on our staff with folks who have dealt with this in the past. And in addition to that, we have 2 full-time social workers on staff, well, 3 actually. One of them is a program manager, and they provide wraparound case management for our students. And we, of course, have connections in the community that we can refer them to for services, so shelters and other domestic violence service programs. In addition to that, we have in the past made sure that all of our staff have been trained on being trauma-informed and how to make that approach, especially when women who are attending our class or who have already entered the trades are calling us. We want to make sure that all of our staff can appropriately respond to them when those calls do come. In serving that end, we have recently done an audit of our program, and one of the things that we're building in more comprehensively is that trauma-informed approach, not just for when folks call us to talk about issues of domestic violence or harassment that they may experience on their work sites, but in the approach that we have with them in our training program as well. So the other thing that often happens for us as a pre-apprenticeship program, and especially because we specifically work with women, we are seen as a support organization for all of the trades. So unions, apprenticeship programs, contractors often contact us to understand more about how they can be supporting women, as well as women who haven't even gone through our program but who heard about us through other avenues. So I wanted to highlight a few things that we are doing at Oregon Tradeswomen that overlap. First, we are implementing a bystander intervention project with a program called Green Dot, which I suspect some folks on the call are familiar with their program. It teaches bystander intervention, and we are working with them to prevent harassment on work sites, but what we know about the Green Dot program is that it also overlaps. So when you teach folks realistic bystander intervention skills, they learn how to apply them in other contexts. And so on the project that we're piloting on, we have also seen an increase in folks reporting domestic violence or sexual violence that they might be experiencing on their work site or even contacting us after seeing the Green Dot program. The other piece that we often see when folks come to us to talk about those types of issues is that unfortunately in construction there is still a high rate of harassment, bullying, hazing, specifically sexual harassment in the industry. And so sometimes we do see folks having that compounded trauma where they are experiencing trauma at home and then they're also experiencing trauma on the work site, or if they've had that in their past. So sometimes what they experience on a work site may not seem as impactful as someone else might perceive it to be, but for them, because they've had that previous violence, it can have a much larger impact for them, and especially for folks who are experiencing PTSD. So that's definitely a consideration that we take into account. The other piece is we are cooperating closely with our local apprenticeship programs. We have been lucky enough to be invited. They have monthly meetings, and we are attending every other month to provide training to all of the apprenticeship coordinators, and domestic violence is one of the topics. And we think that's crucial to making sure that they can support anyone experiencing intimate partner violence or other forms of violence, that they understand the dynamics of domestic violence, and understand how they can get access to help and community resources. And one area that they also need support in is support educating their contractors so that the direct employers also know. I want to get into a few specific examples of things that we've seen happen and how we responded. One example that I have had reported to me multiple times, but I will use the story of a woman whose name I have changed for confidentiality purposes, named Julia. She was an apprentice at the time, and as an apprentice, you are assigned a journey worker who works directly with you to teach you how to do the trade. Unfortunately, Julia was in an abusive relationship, and her partner was also in the same trade as her, and her partner was assigned to be her direct journey worker. So you can imagine the impact of that was very significant, because then not only did he have that control at home, he then also had the control at work and was able to have an impact on her apprenticeship training, what he actually taught her of the trade. He was able to be violent with her at work. And so in that case, we worked closely with the apprenticeship program to start working on implementing some best practices, including ensuring that no one is assigned to have their journey worker be their partner, regardless of whether there's any signs of abuse or not. So they had to implement some more cautions to make sure that that didn't happen. Another example that happens frequently is in our pre-apprenticeship program. We have had students who are experiencing intimate partner violence, and we regularly have that. In one particular instance, it had escalated to where the abuser was showing up. So we were careful to make sure that there was awareness for staff, a safety plan for staff, and a safety plan for that student, and then connecting them with those wraparound services as well. So that's something for training programs to be aware of, and was mentioned previously, is ensuring that you have those safety plan options when those incidents do occur. At another time, and one thing that I think is really important in construction, especially for advocates that are there, that are on this call, I think thinking about reaching out to union representatives in construction and providing education for them around domestic violence. We've had quite a few union representatives contact us when they found out that one of their members is experiencing intimate partner violence, and they are often at a loss of what they feel like they can do. So for us, it's just having that conversation with them about how they can actually support someone experiencing violence, making sure that they're listening with empathy and providing validation, but then also making sure that they are able to connect to that person with the appropriate services. And not have instances where one union rep, for example, decided to take someone into his home. So trying to support them through, yes, you can support someone, but also not putting your own family in danger. And the last one I want to mention is that we've been asked to help many of the local apprenticeship programs start mentorship programs within their organizations. And so we've advocated that training around intimate partner violence as well as violence that happens on work sites be a part of that training for mentors. So we talk to them about active listening, providing validation, but we also provide education around the local resources that they can refer folks to when they maybe have one of their mentees coming to them who is experiencing any form of violence. So those are just a few highlights. I'm sure I could talk for a while longer, but I want to highlight a few more resources for folks. I just really want to drive home the workplace safety equity with Futures Without Violence, and also the Workplaces Respond. I use those resources regularly with our programs to help them change their policies and implement best practices, so I really encourage you to check out those websites. If you're interested in learning more about Oregon Tradeswomen specifically, our website is www.tradeswomen.net, and it's on this slide. And the last one that I want to highlight is the Western Resource Center for Women in Apprenticeship. So in addition to the National Center for Equity on Women in Apprenticeship and Employment, this Western Resource Center was developed with 3 pre-apprenticeship programs over here on the West Coast, and we serve the 13 Western states. But any of you are welcome to log on there for those free resources. And in particular, if you have someone who is considering a career in the trades, there's a Apprenticeship 101 video on the homepage of the website that you could easily access to help educate someone about these career options. The last piece I want to mention is for any apprenticeship programs that might be on the call, or unions or contractors, is that some states do have domestic violence leave laws, and often construction is exempt from those kinds of leave laws, but I would encourage anyone to go ahead and look up and see if your state has those and if they would apply to your organization. Unions could also consider putting domestic violence leave into their collective bargaining agreements to help make sure that they protect their members. With that, I'm really excited to go ahead and turn it over to Erica. Thank you all so much for your time.
Thank you so much. Hi, my name is Erica Yingling, and I am the Director of Non-Residential Domestic Violence Services at the YWCA Greater Cincinnati. So hello to all our fellow YWCA people. I think we offer a unique perspective. This year we are celebrating 150 years. YWCAs in general are 160 years old this year. We are the 5th oldest in the country, but we began promoting economic advancement for women and girls and economic security in the late 1800s. So the opportunity presented itself a couple years ago when employers and work accreditation programs were trying to understand why participants were dropping out and they had high levels of recidivism. So this is a project I'm going to talk about today that we did here in Cincinnati with many different community partners in workforce development and training accreditation programs. And then I'm going to talk about what our next steps have been. We've developed a curriculum, we developed a screen, but we're working to try to pervade more employers to have this response. So just a little bit about the YWCA. I already mentioned some of it, and really our focus on the economic empowerment and advancement of women and girls. We do here have a really unique perspective, again, because we are a domestic violence and sexual assault serving agency that serves 4 counties in southwest Ohio, but we also have a workforce development program that focuses on training, accreditation, educational opportunity and advancement like GED. So there's a lot of crossover within our other programming that focuses on domestic violence and sexual assault into our workforce development program. We have the only domestic violence shelter here in Hamilton County, Ohio that has 74 beds and is almost always full. So using people that are already entering in our program because they're experiencing intimate partner violence or sexual assault and looking at what opportunity we can give them through a training accreditation program or other forms of educational advancement. So we know very much that those are very connected, health and safety and that advancement economically. And we also look at things through the lens of racial justice and inclusion. And that's just a little bit about us. A couple of years ago, we started this project because we were hearing from some community collaborators and other providers in workforce development that they were seeing an increase in domestic violence incidences occurring shortly before women started their job in a non-traditional field or were almost to the point of graduating from that program. And some of those anecdotal stories really did include workplace violence on site. It was also a response from the participants about having they couldn't finish because they felt unsafe at home, and then the providers did not know what to do. This obviously interfered with women's completion of the training program and halted their ability for career advancement. And I think in our own agency, we started to see that as well. We would have a number of people begin a training accreditation or educational program, and at the end, we would have only a handful graduate, and they were predominantly our male participants. So wanting to understand more. And we also realized that there was a lack of data on prevalence of IPV among women seeking workforce development training in our own community. So in order for us to understand what we needed to do in our community, we initiated this project. So the pilot sites were the Brighton Center, and these are all workforce development agencies, Cincinnati Works, the Greater Cincinnati Urban League, Santa Maria Community-Based Services, and the YWCA Greater Cincinnati. So all of those, including ourselves, deliver workforce development programming. We are the only community-based provider in that group of domestic violence and sexual assault services. So the project process really focused on a universal intimate partner violence and trauma-informed care training for all staff. And I know we've said this word, trauma-informed care, throughout the course of this presentation today, but it really is imperative that we are able not just to gloss over what intimate partner violence is, what workplace violence is, and how do we deliver trauma-informed care training and really relationship building with our clients that we're serving. So this requires agencies and employers, workforce development programs to be invested in that and to commit time to a really comprehensive all-day training. So we did that at all of our partner sites, the 4 workforce development programs, and we were the provider of that training as we've created the curriculum. We then had staff members administer at intake or soon after orientation a screen for intimate partner violence. It wasn't a standalone screen. It's a screen that's included in other questions around basic needs, resources, transportation obstacles, to get a better idea of if that person felt safe at home or did they feel as if somebody would prevent them from succeeding in this program. So positive disclosures were offered resources and referrals to local domestic violence program, including ourselves. And it wasn't just a cold phone call. It was actually a handoff to an advocate that worked with that person who had a positive disclosure. So the findings, I think, really were quite compelling and allowed us to troubleshoot some things and move into our next phase. Individual agency reports of abuse varied from 3 to 43%. And there are reasons for that. And the average is 30% across all 5 of those agencies. Of those who reported IPV, or intimidation or violence in the home, 81% of them were women, whereas 19% were men. There was up to 64% screened that had children in the home versus up to 26% who did not have children in the home. And as a domestic violence sexual assault serving agency, we know just that fact of having children in the home and not knowing that particular agency's rules or regulations around mandating reporting could prevent somebody from disclosing for fear of what could happen to their children. Of those screened, 31% were identified as white, 63% black, and 2% as Hispanic. So when we look back at the 3 to 43%, we did notice that the domestic violence serving agency, ourselves, had the highest rate of disclosures because it's an easy connection and an easy handoff to be on site and to offer advocacy and services. We also found that the gender of the screener mattered. And in fact, when there was a female screening another female, they were more likely to get a positive disclosure. And the male screeners expressed discomfort in talking about these things and often had the lowest, that 3% screening. So after doing some troubleshooting and realizing this was a pervasive issue, we said, what's next? Our WorkSafe training curriculum is in the process of being developed, and we have several projects with other employers outside of workforce development that are interested in this curriculum, policy, and training process. We are collaborating with other for-profit employers to address IPV in the workplace, best practice policy, and referral and advocacy and process. We really believe that you have to have that connection between that community-based agency that's really going to allow for trauma-informed care and advocacy for that person who's experiencing intimate partner violence in the workplace. So we have continued community work group with survivors from healthcare fields, call center fields, our United Way here in Greater Cincinnati, and other victim service agencies. We're working together with a local organization called Design Impact, which really is about human design and bringing survivors, community-based providers, and employers to the table to develop that toolkit, policy, and process for providing that safety, support, and justice to workers who are impacted by IPV. So one of the things, and this is not an easy process, we've been meeting together for a year. The survivor's voice is particularly important to this process. They're able to guide the decisions that we're making as employers and as victim service agencies. Because they were brought to the table, they were terminated, unable to succeed from their job, from their training program or job because they were experiencing IPV, and they didn't know where to turn, and they were afraid to tell anybody. So our first concept is the development of a visual map and decision tree and onboarding, and that's really about that comprehensive training process that we need in all spaces of workforce. So it matters because we need people to know what their rights are if they are experiencing intimate partner violence. That was particularly important for our survivors. They didn't know their rights. They feared retaliation, and so much of what was happening, whether it was the constant phone calls they were getting at work, they were coming to work tired, they were upset, that was all looked at through a progress lens of you are not performing to your full level. So taking away that onus on work performance and really looking at advocacy, giving an environment in which survivors feel they can come forward and they feel it's okay to come forward. And that's about creating employee spaces that have access to resources and that know community-based options for that person who's experiencing violence. So we've been working on that. I know I'm running almost out of time, and this is probably one of my favorite ideas, and I think could be really effective in a lot of spaces, is creating a room to heal, and that's a designated and inviting workplace space for people to connect with one another. What we've found as a victim service agency, and this really conjoins with the idea of peer support and advocacy, that people who have similar experience, where it's a non-hierarchical relationship, can heal together and provide support to each other. That is really at the foundation of trauma-informed care and that relationship building. So employers recognize that there is a need for a safe space, that we can promote other employees to rise to the level of leadership as that person to go to if somebody is experiencing a form of violence at home or in the workspace. And that's a little bit, we are almost finished with that level of our work, and we're continuing to really look at ways we can expand into the for-profit realm rather than just working with our workforce development and training accreditation programs here in Cincinnati. Thank you so much for your time, and I guess this is the right time to ask questions if you have any.
Thank you very much, everybody, for your contributions. And we do have a few minutes left for questions. So if you have a question, please type it in. And I see somebody is typing. But in the meantime, here's one from us.
Yeah, this is Sarah. As a domestic violence service provider, and I know there's many on the call, maybe this is for Erica and Tiffany. Can you talk about how you can go ahead and build those relationships proactively with job training programs who might be experiencing this but just not sure what to do and who to reach out to?
Go ahead, Erica. Okay, I'll start. Thank you very much. I think we're really in a time now where those relationships, people are seeking us out. I think we have a different level of understanding in our communities around workplace violence, and for several reasons. I mean, there was just, an incident that occurred yesterday in a workspace that was a domestic violence homicide and suicide of 6 people. With these kind of stories, I think there is just a need and desire to know and learn more. I also really believe that the Me Too movement has, at least in our community, pushed employers to start seeking out best practice policy. What can they do to support others? And I think some of those other relationships we have just organically grown over the years, because when we look at economic safety and justice, we have to look at it through the lens of intimate partner violence. It's probably one of the most pervasive reasons women are not able to achieve economic sustainability and independence. Go ahead, Tiffany.
Thank you. So from my perspective, I would say most job training programs, and especially pre-apprenticeship programs, have informational sessions about their program. So I would suggest you can go to the womensequitycenter.org and find a lot of tradeswomen organizations like mine, and you can go to information sessions that they have, and that allows you to make that warm connection with a staff person at that organization, and from there being able to build the relationship and have that conversation about how the two organizations could potentially partner to go out and educate more employers.
Thank you. There's a question from Grace Navar to Erica to say a little bit more about the Room to Heal idea.
Yeah, I can explain. I was just typing an answer, and I think once you receive the slide packet, you'll see more of what that entails, hopefully. But really, I'll explain here at the YWCA, and being a trauma-informed agency, we've created a room to heal, so to speak. So it is a room all with the design elements of trauma-informed care in mind, but it's a space in which employees could seek out other supports from other employees using that that peer support advocacy model where their confidentiality would be guaranteed, and where they could just go to connect, talk, and build relationships. I mean, when those natural relationships are formed in that space, hopefully that trustworthiness, that voice, and that choice and empowerment for the victim or survivor would be heightened, and then allow them to really access community resources or even disclose that an incident's occurring.
And I think on the, sorry, if I can just elaborate on that, this is Tiffany. I think on the construction side of things, oftentimes you wouldn't have space to have a specific room, but unions, apprenticeship programs, and employers could consider having like a social time, like Oregon Tradeswomen, we have a monthly social hour where folks could get together and discuss those things, even if it's not on the actual work site.
Mm-hmm. Thanks. And there's a question from Tony Says, and maybe you know, Tiffany, whether at the Women Build Nations conference, which is a wonderful conference every year bringing together tradeswomen, and this one is going to be in Seattle. There'll be about 2,000 women working in the trades in October, whether any of the training will be available at the conference. Tiffany, are you going to do a session perhaps at the Pre-Apprenticeship, at the Apprenticeship Institute on the Monday following the same conference?
To my knowledge at this point, there's not a session specifically on domestic violence. We will be talking about workplace violence, so I think it could come up in those trainings, and there's going to be sessions on workplace violence at both the main conference and the Practitioners Institute. But as for just specific on domestic violence, I don't think so this year, but it's a great idea, Tani, for next year, and I know that they had something about it last year.
Well, we've come to the end of our time, unless there are any burning questions out there. Thank you so much, everybody, for participating, for paying attention to this important issue, and thank you very much for my co-presenters. If you do have a couple of minutes, we would really appreciate if you could fill in the evaluation survey. And also, as I said, we are going to share the link of the recording for this webinar. Once again, thank you very much and have a wonderful day.
Thanks, everyone.
Thank you.